seriously, come here. It's really funny. Sit down and watch.
What?
Yeah.
I guess I'll never know what I missed on that first day of health class.
Don't have sex, because you will get pregnant and die.
Not exactly.
Hi, I'm Janet.
Hi, I'm Claudia.
Hi, I'm Candace.
Hi, I'm Chrissy.
Hi, I'm Amanda.
Good afternoon, class. Today we will be discussing the prenatal world.
What is prenatal?
Prenatal is a Latin word that translates literally to pre-birth. We will be discussing the three main stages of prenatal development and milestones for the development of the fetus: germinal, embryonic, and the fetal periods. The germinal period is the first 2 weeks of pregnancy, when the fertilized egg or zygote travels through the fallopian tube and adheres itself to the uterine wall. At this time, the zygote is called a blastocyst, and the outer layer of cells form the placenta, umbilical cord, and amniotic sac, and the inner cells become the embryo. You can think of this system like a house. The placenta is the house where the embryo lives. The amniotic sac is like the house's security system, and the umbilical cord brings all the power to the house. The embryonic period includes weeks 3 through 8 of pregnancy. At this time, the nervous system of the embryo begins to form, and by week 4, its heart begins to beat, and by week 8, almost all body parts are identifiable. During this stage, the embryo goes through cellular differentiation and forms 3 distinct. The ectoderm, which will develop skin, hair, nails, teeth, and the nervous system. The mesoderm will develop into muscles, and the endoderm, which will develop lungs, livers, and pancreas. Organs will form through a process called organogenesis.
Why does the nervous system develop?
Because the nervous system must be fully functioning at time of birth to ensure automatic breathing. Now, the third and final stage is the fetal period. This includes the 3rd month to time of birth. At 12 weeks, the fetus's sex can be determined. At 20 weeks, a discernible heartbeat can be heard, and at 28 weeks, the eyes open and close, and the lungs are capable of breathing. And at 38 weeks, the fetus reacts to light and usually assumes an upside-down position in preparation for birth, and that is the prenatal world.
First transition is during a mother's first trimester. This is when she has to look out for her well-being. That means staying away from off diets, drugs, alcohol, and moderate exercise and a healthy diet will help with her weight gain. The second transition is the child must be accepted unconditionally by the family. This will help with the child's development.
Hey. Hey, how are you?
Good. How are you? I'm sounded a bit worried on the phone. What's wrong?
Well, there's something I really need to tell you. I'm actually pregnant right now.
Oh my god, girl! Girl, why didn't you tell me? I'm like your favorite sister. Dude.
Well, I was scared that you might, reject me or something. So.
Why would I reject you?
Aww.
You're my favorite sister ever. The third transition is the bond between a mother and her child. The mother often feels happiness and joy at the thought of her baby, but she also feels doubt and rejection. The bond grows stronger with the first ultrasound or movement.
Well, Mom, I'm a little worried.
How come, hon?
Because I don't know if I could be a good mother.
It's okay, hon. It's just that you're at the stage where you have mixed emotions, your hormones are going up and down, and that's absolutely fine. Like, I felt the same way with you, mother, and I can tell that you're going to be a perfectly awesome mom.
Aw, thank you.
You're welcome, hon.
The final transition is when the mother fully accepts the role as a mother.
Oh, hey.
Hi, how are you?
Oh, I'm doing good. How about you?
I'm doing good. I feel like dancing. Let's go dancing. Let's go clubbing tonight.
Oh, I really can't go this time.
What do you mean?
I'm pregnant, remember?
That doesn't mean you can't go partying with me.
I really can't. I have to take care of my baby now. Sorry.
Terogens, agents that can cause abnormalities, for example, drugs, chemicals, infections, mother, family, health history, such as diabetics. Terogens fall into two classes: infectious diseases and different type of chemicals. So these are the type of infections and diseases. Phyllosis can cause, and the effects are creates blindness and mental retardation, toxoplasmosis, which are transferred by animals, especially by cats, causes as spontaneous abortions, premature delivery, neurological problems. Rubella is another example, is a German measles, may deliver a baby with cognitive, heart disorders, deafness, mental retardation, and finally, herpes is a STD, and it's causes the nervous system long-term consequences.
Did you know that 20% of pregnant women continue to smoke cigarettes?
More than 13% of pregnant women report drinking alcohol. About 5.5% of pregnant women admit to using illicit drugs. Thalidomide and DES causes abnormalities for the fetus. Smoking during pregnancy affects everything about the reproductive system: fertility, conception, possible abortions, fetal development, labor and delivery, and child's maturation.
Hey, it's nice to see you again. How are you today?
I'm doing good. How are you?
I'm good. Go ahead and follow me and take a seat. Today we're going to be discussing about diagnosing fetal problems. Okay, the reason why we go over this is that we want to make sure that the baby is in good condition as well as for you too. And so I'm going to be discussing some few tools and instruments that usually us doctors would use in order to check for the baby's health as well. And so the first one that we have is prenatal testing. Another test that we also have is testing if the parent, yourself or your husband, is a carrier of any genetic disease. Well, the next one we have is the ultrasound. This is the first main test that we perform. And so the fluid is used to determine the child's sex and also 70 possibly chromosomal abnormality. Is the alpha fetal protein. And basically what alpha fetal protein is, it's a protein that's produced in the baby's liver. And so let's say if we do detect that, we make sure we get a blood sampling from the spinal cord as well.
Oh.
Yes. Well, it's the chronic villi, and what we do is just basically finding the genetic structure of the baby.
Well, I would like to talk to you more about your pregnancy, and there are 3 stages to it. So the first stage is called dilation. That is because the cervix is expanded to 4 inches, and that is responsible for your labor pains. So this time is when the baby adjusts itself in the correct position when it's head first. And the next one is expulsion, which is when the baby begins to come out of your womb. The 3rd stage is afterbirth, is when all the placenta is expelled out of your body.
Yeah, how can my baby be born premature?
Oh, a normal baby would usually be around 280 days and 40 weeks. But as we get to prematurity, there's 3 different types. There's borderline, which is a little underweight, they're slightly underweight. As prematurity worsens, there's moderate, which is a low birth weight, which is LBW. And then there's extreme, which is one that you should be most careful of, because it is a very low birth weight, and they are 24 to 30 weeks, and they weigh 1 to 3.5 pounds. And some causes that do cause prematurity, for instance, age is one of the big factors. The next one will be low economic status, which is SES. It usually happens in underdeveloped countries. Smoking, because it causes growth delays and lung maturity. And next one will be alcohol, because it increases chances by 60%. And lastly, we have cervical problems like high blood pressure and unusual stress.
This has been Chapter 4, Pregnancy and Birth.